I will be presenting my journal club. My moderator for the journal club is Dr. Shobhajak sir. The title for the journal is Effects of Olanzapine Combined with Samidorphan on Weight Gain in Schizophrenia, a 24-week phase 3 study. It was published in American Journal of Psychiatry in the volume 177, issue 12 of November 2019. It was presented on pages 1168 to 1178 and was published online on 1st December 2020. This is the DOI for the journal. The American Journal of Psychiatry is the official journal of American Psychiatric Association and is monthly peer-reviewed medical journal. The first volume was published in 1844, was formerly known as American Journal of Insanity. The title changed from July issue of 1921. The editor-in-chief for the journal is Dr. Ned H. Callan, and the impact factor for the American Journal of Psychiatry is 18.112. The authors and the article information: the principal author, Dr. Christopher U. Correll, and the other authors are Dr. John W. Cormer, Bernard Silverman, Lauren D. Petrello, Christian Graham, Ying Jiang, and others. This study was sponsored by Alcom Biopharmaceutical. It was received on December 13 in 2019, and revision was received on March 31st, 2020, and was accepted on 27th April 2020. The background for the journal is the olanzapine treatment is associated with lower rates of hospitalization. Olanzapine's association with weight gain and metabolic sequelae leads to adherence issues and disease progression. The opioid receptor antagonists, they may mitigate medication-associated weight gain or metabolic dysregulations. Samidorphan, it acts as an antagonist at mu-opioid receptors and a partial agonist at kappa as well as delta opioid receptors. The combination of olanzapine and samidorphan is under development for treatment of schizophrenia as well as for bipolar I disorder. The preclinical studies, they have suggested that co-administration of olanzapine and samidorphan was found to attenuate olanzapine-associated weight gain, and it is hypothesized that combination treatment would be associated with significantly less weight gain than olanzapine monotherapy. The main objective of the study is a combination of olanzapine and the opioid receptor antagonist samidorphan to provide the efficacy of olanzapine while mitigating the olanzapine-associated weight gain. The methods of the study design, it is a phase 3 multi-center randomized double-blind study. The site of the study was done at various sites in United States. The study protocol and all amendments were approved by the Institutional Review Board at each study site. Methods, the participant recruitment. First is the inclusion criteria. The patients aged from 18 to 55 years were included, who met the DSM-5 criteria for a primary diagnosis of schizophrenia were enrolled. The outpatients were taken into the study. A baseline body mass index between 18 to 30 were enrolled, and patients who have a stable body weight, who have not self-reported change of less than 5% for at least 3 months before the study initiation were enrolled. The exclusion criteria, a history of treatment, if a patient has a history of treatment-resistant schizophrenia was excluded. If alcohol or any substance abuse was excluded, except for marijuana or tetrahydrocannabinol. Any clinically significant or unstable medical illness, example diabetes, hypo or hypertension, thyroid dysfunction, and a history of seizure disorder or brain tumor were excluded. Opioid agonist use within 14 days of screening, opioid antagonist use within 60 days of screening, or any anticipated use of for opioid treatment was excluded. The use of olanzapine in the last 60 days before screening patients, patients were also excluded. All patients were provided written informed consent after receiving a complete description of the study. The study treatment: combined olanzapine and samidorphan used in the study as a combination of 10 milligram olanzapine and 10 milligram samidorphan, as well as 20 milligram of olanzapine and 10 milligram of samidorphan. The use of psychotropic medications other than study drug was prohibited. Beta blockers, antihistamines, benzodiazepines, and anticholinergic for akathisia or extrapyramidal symptoms could be used during the study. The patients taking other antipsychotic medications were cross-tapered and titrated onto combined olanzapine and samidorphan treatment or olanzapine monotherapy over the past 2 weeks. Over 2 weeks. The first week, the patient received daily doses of combined olanzapine samidorphan of 10 milligram combination or only 10 milligram of olanzapine. In the second week, the olanzapine dosage was increased to 20 milligrams per day. By the end of second, third, or fourth week, the olanzapine dosage could be lowered to 10 milligram per day due to tolerability issues. No dosage adjustments were permitted beyond the week 4. The assessments done during the patient's visits. Weekly, the patients used to visit weekly in the first 6 weeks and then bi-weekly for the remaining 18 weeks. The various assessments during the visits were body weight, waist circumference, vital signs and ECG, adverse events like extrapyramidal symptoms measured on abnormal involuntary movement scale, Simpson-Angus scale, and Barnes akathisia rating scales were applied. The Columbia Suicide Severity Rating Scale, the Positive Negative Syndrome Scale, the Clinical Global Impression Severity Scale, various blood samples for fasting metabolic laboratory parameters like triglycerides, cholesterol, glucose, and insulin were measured. Non-fasting hemoglobin, that is HbA1c, were collected. The primary and the secondary endpoints of the study. The co-primary endpoints were % change from the baseline at week 24 in the body weight, and the patients with more than 10% gain from the baseline at week 24. The secondary endpoint is the patient with more than 7% weight at the week 24. The cutoffs of 10% and 7% were selected on the basis of commonly accepted thresholds of clinically significant changes in weight for weight management as well as psychiatric treatments. Sorry. Statistical analysis. The co-primary endpoints were tested at an alpha of 0.05. The co-primary endpoints changed from baseline in the body weight at week 24 were analyzed by analysis of covariance, that is NCOVA. The covariates were treatment, race, age group, as well as the baseline weight. The results: a total 550 patients who underwent randomization. The combined olanzapine samidorphan group was given, were N274, and the patients in the olanzapine group were 276. In all, 352 patients, that is 64 patients, completed the treatment with similar completion rates in the 2 treatment groups. The most common reason for discontinuation with combined olanzapine samidorphan and the olanzapine were adverse events, 12% in the olanzapine samidorphan group and 9.8% in the olanzapine group. Withdrawal by the participant in 8.4% in the olanzapine samidorphan group and 9.8% in the olanzapine group. Loss to follow-up in 8% patients of olanzapine samidorphan group and 9.4% in the olanzapine group. In results, the first is the drug exposure. The mean olanzapine dosage was similar between the groups. That is, combined olanzapine samidorphan group received a 16.8 milligram per day dose, and olanzapine group received a 16.9 milligram per day. The most patients, like 79.6% patients, were taking 20 milligrams per day as the final dosage of olanzapine. The concomitant medication use. The most frequently used concomitant medications, that is more than 10% in either treatment group in the combined olanzapine as well as in the olanzapine groups, were risperidone, seen in 20.1% in the olanzapine samidorphan group and 20.3% in the olanzapine group. Ibuprofen, seen in 12.4% patients in olanzapine in the combination group and 10.9% in the only olanzapine group. Quetiapine fumarate, 10.6% use was seen in the combined group and 12% was seen in the olanzapine group. And aripiprazole use was seen in 5.8% patient in the combination group and 10.5% in the olanzapine group. The concomitant use of non-olanzapine antipsychotics reflects patient tapering of their prior antipsychotic medication during the first 2 weeks of the screening. The weight and the metabolic effects, the co-primary endpoints, the change from baseline in the body weight at week 24. It was seen in olanzapine samidorphan group was 4.21%, and in the olanzapine group, it was 6.59%. The difference between the combined olanzapine samidorphan group and the olanzapine group was 22.38% with a standard error of 0.765 with a p-value of 0.003, which is statistically significant. The weight gain in the combined olanzapine samidorphan group stabilized from the week 6, but the weight continued to increase in the olanzapine group over the 24-week treatment period. At week 24, the change in the body weight was 3.18 kgs in the olanzapine samidorphan group and 5.08 kgs in the olanzapine group. The odds ratio of more than 10% weight gain at week 24 in the combined olanzapine samidorphan group in comparison to with the olanzapine group was 0.50 with 95% confidence interval of 0.31 and 0.80 with a p-value of 0.003, which is statistically significant. The secondary endpoint, the experience of more than 7% weight gain in the olanzapine samidorphan group was seen as 27.5%. In the olanzapine group was 42.7%. The number needed to treat for this group is 6.29. The odds ratio for more than 7% weight gain at week 24 with the combined in comparison to the olanzapine group was 0.50 with a p-value of 0.001, which is statistically significant. At waist circumference, at week 24, the mean change from baseline in the waist circumference was 2.36 centimeters. At week 24, the olanzapine samidorphan group reported 26.8% increase and olanzapine group reported of 43.2%. A waist circumference increase of more than 5 centimeters is associated with increased mortality risks, and the risk difference was 217.1% with a 95% confidence interval of 226.3 and 27.8 with the odds ratio of 0.47. The metabolic liability parameters. Baseline to week 24 in the glycemic and the lipid laboratory parameters were generally small and similar in the two treatment groups. The largest increase in these parameters were in the triglyceride levels mean increase. It was seen in the combination olanzapine and samidorphan group of 26.77 milligrams per deciliter, and in the olanzapine groups it was 29.36 milligrams per deciliter. Safety adverse events were in the olanzapine samidorphan group, it was reported in 74.1% cases, and in the olanzapine group, it was reported in 82.2% cases. The most commonly reported adverse events in more than 2% cases, more than 10% in the two groups were weight gain, weight increase. It was reported in 24.8% patients in the combination and 36.2% in the olanzapine group. Somnolence in 21.2% in the combination and 18.1% in the olanzapine group. Dry mouth 12.8% in the combination and 8% in the olanzapine group, and increased appetite in 10.9% in the combination group and 12.3% in the olanzapine group. Most adverse events were mild to moderate in severity Patient who discontinued treatment because of an adverse events were 12% in the combined olanzapine and samidorphan group and 9.8% in the olanzapine group. No deaths were occurred during the study. Serious adverse events were reported more in the olanzapine and samidorphan group, that is 3.6% and 2.5% in the olanzapine group. The serious adverse events occurring in more than one patient was worsening of schizophrenia symptoms. That was reported in one patient in the combination group and 3 patients in the olanzapine group. No clinical changes or differences were observed in the vital signs, ECG results, movement disorder scale scores, or Columbia Suicide Severity Rating Scale scores for the patient in the 2 treatment groups. The overall safety profile of combined olanzapine and samidorphan in this 24-week study was consistent with that of olanzapine, except for fewer adverse events of weight increase in the combined olanzapine samidorphan group. The antipsychotic efficacy, the PANSS and CGI-S scores, the mean PANSS total score at baseline was olanzapine in the olanzapine samidorphan group, it was 68.2, and in the olanzapine group was 70.2. The PANSS total score improved similarly in the both groups at week 24. In the olanzapine samidorphan group, it was 28.2, and in the olanzapine group was 29.4, which is similar. The least square mean difference between the 2 treatment was only 1.2. The reduction in the CGI-S score from the baseline to week 24 was similar between the 2 treatment groups, consistent with the changes in the PANSS total scores. Discussion. The treatment with the combined olanzapine samidorphan resulted in significantly less weight gain compared with the olanzapine monotherapy. The differences in the weight gain were apparent at week 6 and remained lower in the combined olanzapine samidorphan group at each subsequent visit through week 24. The risk of clinically significant weight gain of more than 7% and of more than 10% was reduced by 50% by the combination treatment over olanzapine. The mean increase in the weight in this study was 3.18 kgs in the combined olanzapine samidorphan group and 5.08 in the olanzapine group at week 24. The olanzapine samidorphan combined was also associated with significantly smaller increase in the waist circumference when comparison with the olanzapine. The separation in the waist circumference for combined olanzapine samidorphan versus olanzapine occurred earlier than the separation in the weight due to different distribution of the weight. A shift from the increasing abdominal adiposity leads to reduction of cardiovascular and diabetes risks with combined olanzapine samidorphan in comparison to only olanzapine. The combined olanzapine samidorphan, the risk of having a waist circumference increase of more than 5 centimeters was reduced by approximately 50% in comparison with olanzapine. No differences between the combined olanzapine samidorphan and no differences between combined olanzapine samidorphan and olanzapine on the metabolically laboratory parameters was assessed. Changes in the fasting lipid and glycemic parameters with olanzapine treatment were generally small at 24 weeks, limiting the ability to detect differences with combined olanzapine and samidorphan group. For both treatments, changes in the metabolic laboratory parameters generally occurred early within the first few weeks with little changes over the treatment period. The continued weight increases observed with the olanzapine did not translate to any clear metabolic worsening beyond these initial effects. The mitigation of weight gain by combined olanzapine samidorphan did not potential pitfall in trying to relate olanzapine associated metabolic changes solely to changes in the body weight. The samidorphan attenuates olanzapine associated changes in the fat masses by a blockade of adipose glucose uptake and by preventing olanzapine induced insulin resistance. The conclusion of the study was combined olanzapine and samidorphan was found to mitigate the important side effect of olanzapine associated weight gain while maintaining the established antipsychotic efficacy of olanzapine. The limitations of the study. The 40% of the patients discontinued the study early, leading to a relatively high volume of missing data. The fasting status were based solely on the patient's self-report without the independent confirmation. That is, samples may not have been truly fasting in all the cases. The restrictive BMI criterion for the study at end the entry, like a BMI, the patients were selected in a range of BMI of 18 to 30. The patients more than 55 years were excluded from the study. The patients with long illness and antipsychotic treatment resistant histories were excluded from the studies, and a 6-month duration of this study may have been insufficient to detect these secondary weight-related changes in the metabolic risk factors. Thank you so much.
Thank you, Dr. Mumtaz. Any questions, comments from the interns, psychology students, or psychiatry residents, faculty? No questions. I would like to first thank Dr. Mumtaz. Actually, she was given an option of skipping this presentation because she was down with COVID, but she was eager enough to not let it miss, as she has already presented the presentation, and I think she has done a very good job. I wonder if any one of us down with COVID, we would have been dared enough to give a presentation the next day. I think you deserve a good rest, and we presented well. This study is very important because of the weight gain is an issue with olanzapine. Most of the times we have to actually discontinue olanzapine because of the weight gain. Nothing much works if patient is not ready to modify the lifestyle. So in this sense, this study is clinically very important. Samidorphan, it reverses this insulin resistance because of olanzapine. And also, important part is Dr. Aditi and Dr. Tanya, you are doing an intervention study. So important is recording side effects and discontinuation rates. As you have seen, this study has vividly reported that.
Yes,
so with
sir.
these 2 comments, we would like to end this presentation. And thank you, Dr. Mumtaz.
Thank you
so much.
Thank you.
Yeah.